In the article, Infertility and the Role of Psychotherapy, Valerie Hart states that infertility affects 6 million American women and their partners. That's about 10% of the reproductive age population. That statistic equates to about 1 in 5 couples. What this means is, if you can think of 5 couples who are currently trying to have kids, be that aunts, uncles, best friends, cousins, then you are very likely to know somebody who is going through an infertility journey, and you may not even know it. Did you know that infertility became an established disability when the Supreme Court held in 1998 that infertility is a disability under the Americans with Disabilities Act, where disability means a physical or mental impairment that substantially limits one or more major life activities. The reason the topic of mandated insurance coverage for infertility means so much to me personally is in January of 2021, I was officially diagnosed as one of the 1 in 5 couples who are likely to go through infertility. I was told I officially had infertility after a 6-year journey to try to conceive. For years, people with infertility have been forced to pay for their medical care out of pocket, while insurance companies got away with denying their coverages. However, if the HR 4450 passes the House of Representatives and Congress, then we'll be on our way to a place where infertility sufferers no longer have to worry about how much money they make and as it relates to whether or not they get to have children. First, we'll take a look at the financial toll paying for infertility treatment out of pocket for sufferers can be. So, this is my first visual aid. In the article, Infertility and the ADA, Health Insurance Coverage for Infertility Treatment, Bonnie Gilbert writes, infertility is defined as the condition of a presumably healthy individual who is unable to conceive or produce conception during a period of 1 year. What that means is anybody who meets this criteria is likely to have to pay out of pocket for medical treatment. According to CNY Fertility in the article, IV Cost, Analyzing the True Cost of In Vitro Fertilization, the average cost of 1 round of fresh IVF lies between $4,700 and approximately $30,000 for 1 round. In my case, due to the rising cost of IVF, me and my husband Samuel decided to never do IVF. If we ever got to that place, we would just not go there because it's so expensive and there's no guarantees that that is going to give you a bring home child. Part of the reason for our decision to not do IVF and instead to just turn to adoption is that my mother is adopted, but also I have some personal friends who have tried IVF where they had to do 2 or 3 rounds before they were able to conceive. So if you take that $30,000 high mark and you multiply that by 2 or 3 rounds, you're looking at $100,000 to have a child out of pocket. After observing the financial toll the financial toll of what paying out of pocket can look like for infertility sufferers, now let's look at a bill that can potentially change the game with this medical issue. Visual aid number 2. As of July 16, 2021, a bill was proposed in the House of Representatives called H.R. 4450, also called Access to Infertility Treatment and Care. This bill proposes to require private insurance companies to cover infertility treatment as well as fertility preservation on a national level. This bill states that it will require private health insurance plans to cover specific treatments for infertility, such as IVF or in vitro fertilization. If the plan also covers OBGYN plans. Fertility preservation services for individuals who undergo medically necessary treatments that may cause impairment to fertility. So that think about like cancer sufferers who may have infertility as a result of their chemotherapy treatment. Further, the plan will prohibit companies from incentivizing holders of their insurance plan for foregoing infertility care. And it will it will also ban the reduction of reimbursement rates to providers for such treatments. This bill also extends infertility treatment and fertility preservation coverage to Medicaid enrollees, federal employees, and members of military and veterans. This is a solution that thousands of Americans of infertility sufferers have been waiting for years. If it passes the House of Representatives and also Congress and becomes law, then insurance companies can no longer claim that infertility isn't a medical issue, or that it's just not their problem, they don't have to cover it, or they won't be able to just straight up deny coverage anymore. Now that I've shed some light on the major problem of the lack of mandated insurance coverage for infertility care, and have introduced the HR 4450 as a solution to this issue, I hope you will feel as passionately about the subject as I do. With the financial toll of out-of-pocket infertility care becoming a barricade to those who want to conceive, we now look to the HR 4450 bill as a solution to this problem. While many college students aren't quite yet ready to settle down and start thinking about children, it is important to remember that infertility is indiscriminate, and it can affect people as young as 20, which is how old I was when I first started to get a clue that my fertility journey may not be as smooth and as easy as I once thought it would be. If you're still sitting on the fence, please remember that infertility affects roughly 1 in 5 families. So if you can come up with 1 in 5 families who are trying to have kids, the odds are one of those couples will have to face infertility and the financial toll that comes with that. If you would like to help contribute to seeing the HR 4450 bill pass House of Representatives and hopefully also pass Congress to one day become law, then I encourage you to write to our House of Representatives for Tennessee and let them know how passionately you feel about this, as well as how passionately you feel about the 4450 bill. And with that, if you feel so inclined, also to reach out to our Tennessee Congress people and let them know as well that we need the bill to pass not just in the House of Representatives, but in Congress as well.